has become president of World Federation's Neurosurgical Societies, WFNS, as well as professor in his institution, certainly has a lot of experience that we can make as a role model for us. He is certainly very well trained in dealing with various problems related to the development of research and education. This valuable experience will be delivered to us and shared to all of us through the morning scientific oration session. And we hope continue to the program, especially in Adjunct Professor program. I believe this meeting will help shape our perspective further and also give us a chance to reflect and think more objective about the system of education for Universitas Airlangga. So, to summarize, we are really honored to have Professor Servadei as honorary professor. We are also glad to see so many of you here today, all of participants from Universitas Indonesia, from Universitas Pajajaran, Universitas Udayana, and Universitas in all of universitas in Indonesia too, and all of university in the world, like in Malaysia, Pakistan, and Philippines, and Brunei, like yesterday. Yeah, so many university networking in the world and in Indonesia. Thank you very much for this kindness. Yeah. Yeah, so as on behalf of our deans, Faculty of Medicine, Universitas Airlangga, it gave me great pleasure to present the honorary professor degree to Professor Servadei for his lifetime concern, Prof, and contribution to the development of, especially on neurosurgical fields. We know all of my faculty colleagues, present and past, join us in expressing our gratitude to you in this modus and heartfelt manner. Thank you very much, Professor Servadei, and thank you for all participants for your kind attention. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you very much for the Vice Dean, Professor Nimade Martaniasi. Next, we would like to invite Professor Franco Servadei to deliver the scientific orations with the topic, how can we bridge the gap between developed and developing countries in research and education. To Professor Franco Servadei, you might take the floor.
Okay, good morning to everybody. It's my honor to be here. It's in this prestigious university where we already collaborate with your institution and the Department of Neurosurgery, as you have seen from pictures from at least 3 years. First of all, I have to thank Professor Santoso, Vice Rector, Professor Mertagnasi, Vice Dean, Dr. Agus Turchon, Head of Department of Neurosurgery, and of course, Professor Bayamal, that I know since many years. I think in medicine and in general in education, there is a big gap between two parts of our world. One part is developing but growing in medicine very quickly. Even coming here 3 years ago and now, things are different. There is a deep growth in international relationships. There is a deep growth in devices available. There is a deep growth in education. Yesterday, we had a very important meeting with the Indonesian Neurosurgical Society, and I learned, for instance, I learned how to open new department in part of Indonesia where there are no neurosurgery, and I will show it in slides. So it's my honor to be here, and it's my honor to accept your offer to become adjunct professor here. Where I come from, it's Milano. Milan, it's north of Italy, and as in many parts of my country, there is a big contradiction between new and old part of the city. As you see, this is the main church in Milano. It's about 600 years old, and this is the new direction center of the country. My university is the Humanitas University. It's a new university which is part of the Milano University, which was founded 1307 in the 14th century. But my university is a new university, is a new faculty of medicine in English, who is fully part of the European Union education university, who are part of the new network of education system. All of them are in English language. So the teaching for students is in English, and all of postgraduate teaching is in English. I come from a neurosurgical center where we do about 3,000 procedures per year with everything, every part of the neurosurgical field is covered by my big unit, which is the worldwide scenario. If we want to talk about global education, we need to know which is the main problem. Neurosurgeons are surgeons. So what is the scenario for surgeons all over the world? This is the life expectancy in the population. There are countries like the one I came from, who are number 6 in the world, where the life expectancy is about over 80 years. And there are countries, mainly in Africa, where the life expectancy is about 45 years. As you see, Indonesia, it's here, and is in this part. So it's about 15 years of age span less than Europe. And this is the world as we can draw with the number of surgeons available. Surgeons, I'm not talking about physician. Surgeon per population. So Africa is almost non-existing. You see, East Asia here is small, Japan is very big, and you see Europe is oversized. So there is a big disparities in the world according to the number of available physicians and surgeons. We have a new concept coming from the World Health Organization since 2014, which in surgery is now the World Health Organization in disease only. They realized that also surgery is an important improvement which should be added to the capacity of medical care. This was done by the WHO in 2014. What is the problem? You see it here. 5 billion people lack access to safe surgical and anesthesia. 3/4 of the surgical procedure are performed by 1/3 of the world population. Big disparities. Only 4% of the global health research is in surgery. Out of all surgical research, 4% only is relevant to the unserved population. So the publication, we will see it at the end of my presentation, come from one part of the world. The cure is done in one part of the world and the patient are in the other part of the world. Which is the problem? The main problem, talking about surgery, I am a surgeon, is shortage of surgeons, lack of standards, lack of equipment, lack of innovation. I will discuss with you these topics. How can we do innovation? How can we, I will concentrate on new forms of education, which are important to me. The United Nations in Global Health has put surgery on towards 2030. And this is the second paper from this area showing you can see it here, that there is the possibility to avoid 1.5 million deaths related to improper or not done surgery all over the world. So we have a big task. Then the World Health Organization gave a list of 44 surgeries who are needed in that part of the world who is developing. Neurosurgery is in 4 of these 44, in spine, in traumatic brain injury, and in shunt for hydrocephalus. This procedure is the one which I have in the list a should-do position, meaning that the World Health Organization will help to improve these surgeries in developing part of the world. We have recently written a paper about how neurosurgery is part of this global surgery. And as you see it from this map, these are the number of available neurosurgeons. When it's green, it's enough. When it's red, it's not enough. When it's yellow, it's in between. You see you are here, in between. So the number of surgeons and the number of neurosurgeons in Indonesia, we will see, is still not enough. And we will see how to do it. Then we have identified in this publication the need for 10 diseases that can be cured by neurosurgeons. And you see that we have calculated 14 million new operations per year in neurosurgery all over the world. 3.5 Asia is a very important part of our work as surgeons and as neurosurgeons. But the number of neurosurgeons, as I told you, is very different. We have at the moment about 50,000 neurosurgeons all over the world, but 44 of them live in high-income countries. Almost half of them are living in high-income countries with big disparities. This is the world. You can click in our website and see how many neurosurgeons. So we know that the target for the world is 1 neurosurgeon per 100,000 inhabitants, 10 per 1 million. In my country or United States, we have more than we need. In France, not the same. But in Asia, you have Japan, who has a lot of neurosurgeons, generally Japan has a lot of physicians. Australia, it's just above the limit. Indonesia has 300, I learned yesterday night, 350 neurosurgeons per 250 more population inhabitants. It means 0.1, very little as compared to other countries, 0.12 actually. This is Asia, Philippines, Cambodia, Thailand, Vietnam. As you see, the situation in Asia is very different, with Philippines with the shortest number of surgeons. We have written actually an editorial in World Neurosurgery, the role of neurosurgery in countries with limited facilities. This editorial was commented by 3 other editorials, so it was a series of 4 editorials about how we can improve the number and the quality of surgery outside Europe and US. Which are the differences? I remember when you, Teddy, and the friend visited Parma, and we realized how different is the world. This is the unit where I was working in Parma when I was professor in Parma. Now I am in Milano. And this is a simple way. I mean, we have 2 nurses, 2 positions, a lot of monitoring, everything is okay, is working. But this is not Indonesia, this is another part, but is Asia, one part of Asia, where they don't have enough ventilators. So these patients are without ventilators because they don't have enough. They can operate the patient, then they have to wake them up. They don't have possibility. So the world is very different. And we have big institutes in neurosurgery, like in other surgery. This is America. By the way, America is not anymore the place with the largest amount of patients. We will see that it's in other parts of the world now. But this is the largest American neurosurgical center, the Barrow Institute, with 8,000 surgeries per year. This is the new Tien Tan Institute in Beijing, 15,000 surgery per year. This is the Burdenko Institute in Moscow, where I am a professor, honorary professor, is 13,000 operations per year. But this is one part of the world. We also have Rwanda, with 1 neurosurgeon for 4 million people. So the world is different from there to there. What we are doing as an international community and as the World Federation to improve and try to fill this gap between different countries. We have different ways of education in surgery. I'm talking about surgery. We have some frontal lessons and some hands-on, called cadaver lab, simulation, web access. I will talk more about simulation, organized by some committees of our federation. For instance, we have a vascular course, which is both for surgery and endovascular treatment. We have a neuroendoscopy course all over the world. This is in Cairo, in Egypt. We have in Milano, for instance, this is a skull-based course. And you have it here in Indonesia, 2 different courses. This is 3D cinema lectures, which were done in Jakarta. This is the congress we have done in Napoli, in Italy. This is the meeting you are organizing in Bali in 2018 from the Spine Committee of the World Federation together with the Indonesian Society. This is a live surgery seminar, so we have different forms of education. This is, you see it here, is a live surgery. course, a neural anatomy course which was held in Kenya. You see it here.